Now for this patient, we're going to do Astym on the back and shoulders, starting out with a specific Astym movement to the supraspinatus muscle belly, having him retest motion after 4 strokes applied. Usually patients will have some kind of impairment in the shoulder, like shoulder impingement or possibly a partial tear, trying to prevent rotator cuff surgery. Astym treatment is a common manual therapy tool used for patients with repetitive stress syndromes, especially through a tendon. Patients who work with their hands or in construction will have a lot of repetitive stress around the elbow. The goal for every Astym treatment is to take degenerative tissues and increase regeneration. And then if you have scar and fibrosis in an area, it's to encourage reabsorption. Soft tissue fibrosis and scarring is the body's natural response to trauma, from traumatic injuries, surgical trauma, and repetitive use. Scar tissue is often laid down in dysfunctional patterns that are excessive or disorganized and may restrict movement and cause pain. Astym treatment is an ideal in restoring soft tissues to their pre-injury state. Right now for this patient, we're working over the AC joint as part of his upper extremity treatment. Releasing antagonist muscles is an important part of Astym as well. Getting rid of tightness through the pecs can help the scapular muscles initiate motion and allow for a good stretch and normalized position of the shoulder. For this patient, we're working on the rotator cuff tendons with his arm behind his back. Now we moved into a seated position to expose the trap, mid-trap, lower trap muscles and rhomboids. Astym can be a great treatment for patients with neck pain. Decreasing tissue tightness in the cervical spine is an important manual technique and important to achieving patient's goal for full flexibility. Realigning the tissues, decreasing pain, all goals for cervical spine treatments that can be added with Astym. Now we're in side lying, working on releasing the tissues that connect to the shoulder blade and attach to the spine. What you don't see is me reapplying a lotion to the skin, so I'm not directly rubbing the tool without a medium between the two of us, so it's a comfortable treatment for the patient. He does have some reddening of the skin, which is normal for the treatment.